Welcome to a special clinical narrative. Today, we follow the 10-year journey of Emma, a patient whose experience illuminates the complex reality of female pattern hair loss and PCOS. Our story begins a decade ago. Emma was just 22, living in Milano, when she noticed her ponytail felt thinner. At first, she attributed it to the stress of her studies. For the first 3 years, the changes were subtle but persistent. She noticed more hair in her brush and a gradual widening of her part, the first signs of diffuse thinning. By year 5, Emma sought answers. At our Milano clinic, she was diagnosed with PCOS. This condition is a primary driver of hair loss due to an excess of male hormones or hyperandrogenism. In the welcoming environment of our Milano clinic, Emma underwent a comprehensive evaluation to understand how her metabolic health was impacting her hair density. Clinical examination revealed the Ludwig pattern of diffuse thinning. We also looked for the Olsen Christmas tree pattern, common in PCOS-related hair loss, where the frontal hairline remains intact. In our Pavia facility, we utilized high-resolution dermoscopy. We look for hair diameter diversity, specifically finding more than 20% miniaturized hairs to confirm FPHL. Emma's blood panels were vital. AAD guidelines emphasize testing for testosterone using LC/MS assays, along with DHEA-S, ferritin for iron, and vitamin D levels. The labs confirmed elevated androgens. Specifically, DHT was binding to her follicles, triggering miniaturization, the process where thick hairs are replaced by thin, vellus hairs. Emma also dealt with acne and hirsutism. It's the PCOS paradox. The same androgens that thin scalp hair can thicken hair on the face and body. By year 7, Emma realized her hair loss wasn't constant. It occurred in fits and bursts, often exacerbated by the chronic low-grade inflammation typical of PCOS. Insulin resistance played a hidden role. High insulin levels drive the ovaries to produce even more testosterone, creating a feedback loop that fuels hair loss. Emma's treatment plan was holistic. Our first goal was to arrest the progression in FPHL. Stabilization is the first and most important victory. We started with 5% topical minoxidil foam. This gold standard treatment works by prolonging the anagen growth phase and increasing blood flow to the follicles. When topical use became irritating, we transitioned Emma to low-dose oral minoxidil, typically titrated between 0.25 and 1.25 milligrams daily for superior efficacy. To address the hormonal route, we added spironolactone. Dosages of 100 to 200 milligrams daily are often required to effectively block androgen receptors. By year 9, we focused on her metabolic health. Adding metformin and a low-glycemic diet helped lower the insulin levels that were driving her testosterone production. Emma also incorporated advanced clinical procedures. These were performed in our specialized units to ensure the highest standards of safety and efficacy. She explored regenerative options like platelet-rich plasma and next-generation exosome therapy, which delivers concentrated growth factors directly to the scalp. Low-level laser therapy provided a non-invasive way to stimulate cellular activity, helping to maintain the health of her existing follicles. Emma learned that dermatological success requires patience. It typically takes 6 to 12 months of consistent therapy to see visible changes in hair density. Long-term maintenance is essential. Because the drivers of PCOS remain, stopping treatment often leads to a return to baseline within a few months. We also prioritize Emma's mental well-being. Hair loss is a source of chronic stress, and addressing the psychological impact was vital for her overall recovery. Support groups and holistic care helped Emma regain her self-esteem. She moved from a place of anxiety to one of confidence and empowerment. 10 years later, Emma's hair loss is stabilized. Her journey shows that with the right clinical guidance and a holistic approach, a better future is possible. If you are facing a similar journey, remember that early diagnosis is key. Consult a specialist to develop a plan tailored to your unique biology. Thank you for joining us for this clinical masterclass. For more resources or to book a consultation, visit our website. Take care. Clinical sources: American Academy of Dermatology, British Association of Dermatologists, DermNet, and